Have you ever experienced a persistent, uncomfortable sensation in your stomach, perhaps a burning or aching feeling that just will not go away? While many things can cause stomach upset, some specific issues can signal the presence of a common bacterial infection. The stomach problems that often point to an H. pylori infection include a dull or burning pain in the upper abdomen, especially when your stomach is empty, along with unexplained nausea, frequent burping, bloating, and a feeling of fullness after eating only a small amount of food. These symptoms are key indicators that this particular bacterium might be present and causing irritation to your stomach lining. The core reason H. pylori causes these issues is its unique ability to thrive in the harsh acidic environment of your stomach. This bacterium, whose full name is Helicobacter pylori, has specialized enzymes that allow it to neutralize stomach acid around itself, creating a protective cloud. Once it establishes itself, H. pylori can then weaken the protective mucus layer of the stomach and duodenum, which is the first part of your small intestine. This weakening makes the delicate tissues more vulnerable to damage from stomach acid, leading to inflammation known as gastritis, and eventually, the formation of painful open sores called peptic ulcers. If you are experiencing these kinds of persistent stomach troubles, it is really important to talk with your doctor. They can perform simple tests to check for the presence of H. pylori. These might include a breath test, a stool test, or sometimes an endoscopy, where a small camera is used to look inside your stomach and take a tiny tissue sample. Once diagnosed, H. pylori is typically treated with a combination of antibiotics to eradicate the bacteria and medications to reduce stomach acid, helping the stomach lining heal. One interesting fact about H. pylori is that it can also contribute to other, less common, but more serious conditions, such as certain types of stomach cancer and mucosa-associated lymphoid tissue lymphoma, also known as malt lymphoma. While these are rare, it underscores why addressing the infection promptly is so important. Another point to remember is that about half of the world's population carries H. pylori, but many people never experience symptoms, highlighting the complex interplay between the bacteria and individual health factors. Understanding these telltale stomach problems and how H. pylori impacts your digestive system empowers you to take proactive steps. By recognizing these signs and seeking medical advice early, you can get the right diagnosis and treatment, which can relieve discomfort, heal any potential ulcers, and significantly reduce the risk of more serious complications down the road, bringing you back to feeling your best.